Hello, everyone. My name is David Ortiz. I am the faculty fellow for the Center for Latin American and Border Studies, CLABS. It's a pleasure to be here with you. We started a few minutes late. We had a little bit of technical issues. Thank you for patiently waiting. And now we are just giving it a few minutes to let the people into the room. So thank you for being a little bit more patient with us. Hola a todos, bienvenidos. Mi nombre es David Ortiz. Soy el Faculty Fellow del Centro de Estudios Latinoamericanos y de la Frontera aquí en NMSU, CLABS. Gracias por estar con nosotros. Gracias por atender, por venir a este seminario. Estamos esperando que la gente entre al evento, así que denos unos segundos y empezamos. Ok, bienvenidos todos. Gracias por estar aquí. Welcome everyone. Thank you for being here. This is our second speaker series for this semester. And we will have one more coming up in November, and that'll be our last one for the semester. So thank you so much for coming to our speaker series and making it a success. Today we have a really incredible guest speaker, invited guest speaker, Brendon Tucker. Brendon is a senior program consultant at Med Global Mexico, where he oversees primary medical care operations, builds strategic partnerships, and manages daily activities to support vulnerable populations. With more than 6 years of hands-on experience in migration-focused humanitarian work across northern Mexico, he has developed a deep understanding of the complex challenges faced by migrants. Tucker previously led Global Response Medicine's COVID-19 efforts in Matamoros and served as project manager in Reynosa, where he successfully transitioned a key healthcare initiative to local management. As a co-founder of Resource Center Matamoros, he played dual roles as both WASH and camp manager, coordinating the delivery of essential legal, medical, and religious services to displaced communities. His humanitarian work also includes a role as project coordinator with Team Brownsville. In recognition of his contributions, Tucker was named Humanitarian of the Year by Massachusetts General Hospital in 2023. He is also awarded a scholarship for accredited representative training at Villanova University. Notably, his innovative COVID-19 sync design was adopted by the UN and the ripple effect, reflecting his commitment to practical solutions in crisis contexts. So we are incredibly honored to have Tucker here as our speaker today. As you can imagine, he has incredible experience, hands-on experience on border issues, working with migrant populations and populations that are displaced. The title of his talk today will be From Metering to CBP One, the Demise of Asylum and the Commodification of People Seeking It. Without further ado, please give a warm welcome to Brendon Tucker. Brendon, welcome to our speaker series. We are really happy that you're here with us. Let me explain to everyone a little bit of how this is going to work. I am going to give Tucker the floor here. I will mute myself and let him guide us through some of the things that are happening in the border, right? And some of the policies that have happened and how they've changed things in C2 for migrants and other displaced populations. In the meantime, if you want to learn about our speaker series and our upcoming speakers, we will be posting in the chat all of our social media, so please follow us there. Tucker, welcome. Thank you for being here with us.
Hi, everybody, and thank you so much for having me. I just want to let everybody know if my camera goes out, our internet here is a little bit choppy. A lot of people connected at Casa Migrantes, but Yeah, thank you so much for having me. I'm better at field work than presentations, so everybody please bear with me. But I do encourage anybody to as we go, come up with some questions, or if you have any questions, please feel free to ask at the end. I'd love to engage with anybody that would like to know more. But yeah,
And
so
and
I guess to kind
in
of
order, sorry to interrupt you, Tucker. In order to do that, we have actually a Q&A button at the bottom here in our Zoom. So please use that. Use that throughout Tucker's presentation and at the end, like he mentioned. And we will leave time for comments and questions at the end so that Tucker can actually answer them.
awesome. Yeah, so I guess to begin, I mean, we have to pick a point in time and history to kind of cement ourselves in the present. So I mean, like we'll kind of start, I guess, with why we have asylum, right? So after the past largest human migration, which was during World War II, the world collectively decided that there needed to be a ground floor for human rights for people fleeing for their lives, and that is kind of what spurred modern international asylum law and processes. Now, currently, right now, we are experiencing the largest human migration since World War II, and collectively as a globe, we are failing. I mean, in the U.S., public opinion, along with state and federal policies, have steadily shifted farther right year after year. And this is a part of a global trend of more restrictive immigration measures, nationalism, and hardline rhetoric that we see and in the rest of the Western world and Europe as well. So and these policies have led to rising levels of death and massive amounts of suffering across the globe. It's not just specific to the U.S. Mexico border. I mean, countless people have lost their lives in the Mediterranean. People have lost their lives in the Darien, and at every step of the way. But all of this is due to policies that we have right now. So I'm going to kind of give you a quick breakdown, kind of starting in April of 2018, about the time that I got involved and a lot of others got involved. That was when the Trump administration started the family separation policy. And that was kind of the start of that hardline approach towards Trump's militarization of the border. Following that, Trump expanded on Obama's metering policy, which was a policy that essentially only allowed people to come into the United States if there was room in a detention facility for an asylum seeker to go to wait to be paroled out, which was different from in the past, where you would go to your credible fear interview. If you passed your credible fear interview, you would be paroled out, and you would then go to whatever city you were destination for, right? And that's where you would proceed with your asylum hearing. So that was a big shift away from common norms, specifically for asylum. And that's when we really first started seeing people at the border. The first time we started seeing people, at least this most recent wave, I guess it was in July of 2018. And the first group was only about 15 people in total, and they were waiting on the bridge in Matamoros. That shifted into a policy y'all may have heard of called Remain in Mexico. The correct name is the Migrant Protection Protocols. Very Orwellian name. It has nothing to do with protecting migrants and everything to do with mitigating their access to safety. But it was a policy that essentially forced migrants to wait in northern border cities in Mexico while awaiting their U.S. court dates, where they would cross the border, go to a tent court, and then be escorted back across the border to Mexico. Now, during that time, one interesting thing to add is that, in order to apply for asylum in Mexico, you have to be within the country without leaving for a certain period of time. So every time asylum seekers seeking asylum in the United States would cross to the States, their eligibility was then set back every time they would return back to Mexico. Just an interesting quibit. But in March of 2020, the Trump administration invoked a public health order called Title 42. Now, this was never really meant to be used specifically as an immigration policy, but it was essentially used as such. So this allows the U.S. government to stop people from coming in um, if there was an illness, i.e., COVID-19 this time around, that isn't currently inside the United States. But the way that Title 42 was used was very much as an immigration policy, and everybody else was allowed to cross. I mean, there was only one time that I was asked if I was an essential worker going back and forth. The only people that were really limited by Title 42 outside of Mexican nationals that were and regular people coming in for tourism and travel and non-essential work were asylum seekers. And even after Title 42 was MPP was lifted, Title 42 was still in place. MPP was paused in June of 2021, well after the Biden administration had taken office. And in what's it called? And shortly after, that's when CBP One was implemented. Now, CBP One is an application that migrants can apply for asylum. Currently, it's the only way to access asylum inside the United States, where you download an app and you have to, bioscan your face, and you can only apply in certain locations. So you can apply in north of Mexico City, and you can apply in Tabasco and Chiapas. Now, that's led to a whole host of problems that we can get to here in just a little bit. But following the implementation of CBP One, there was still some exceptions. So you could still present yourself at the border. And if they had space, they had to accept you at a certain amount of time. We also had access to emergency cases. So if we identified somebody who was at risk of life or limb, we could get them across the border for emergency health care. There were also some additional ways that people could access emergency crossings, but all of that has since been pretty limited. So in May of 2023, the Biden administration implemented the first asylum ban, which denied asylum to non-Mexican citizens who crossed in between ports of entry or arrived without CBP appointments, again, with limited exceptions, including medical and some psychological. Now, on June 4th of this year, Biden implemented a second, more restrictive asylum ban that essentially expands on the first one, meaning that you can only seek asylum with a CBP One appointment and only at ports of entry. And there was a certain that ban was to only be in place until the total migrant encounters was below 2,500 per day for one full week. Now, that ban was again recently expanded on on October 1st, and they moved that 2,500 per day for 1 week to 2,500 per day for 28 days before lifting the ban. And right now, they're trying to cement that and make that a more permanent policy. And there is a commenting period that is ending on November 4th. So at the end of this, I'll make sure to share some tools that you can use to write your own comment to request that the asylum ban doesn't go into place. But policies like metering, MPP, Title 42, and CBP One disproportionately affect vulnerable migrants. So including women, children, people lacking financial resources, lacking access to safe housing. And we actually conducted a study that recently got published. We conducted the study in Reynosa in February of 2023. And what we found was that 40% of asylum seekers that were a part of the study reported that using CBP One worsened their mental health. 35% had experienced exacerbations for pre-existing physical conditions, and about a quarter of people had to forego paying for medications and health expenditures in order to pay for data in order to apply for asylum. Now, this came with a whole host of issues. So many people are forced to leave safe houses and shelters to try to find better signal. We had one instance where a man was trying to get signal on Tapacasa Migrantes and electrocuted himself on a power line. You know, forcing people to access asylum through a cell phone and an application, essentially, it destroys it. So that whole history is essentially just to discuss the different ways that they have completely dismantled asylum. And you know, if this was still April of 2018, we might be able to go back to Title 8. We might be able to fix this pretty easily. But now, I mean, in order to fix this, it would take so much more effort. Because what happened with Trump's policies was it created a massive bottleneck at the border. It didn't stop people from coming, and it didn't necessarily stop any migration, right? It just kept people from coming into the United States. So in that instance, you know, the Trump administration can say that you know, they had a hardline immigration policy and that there were less people coming in under his administration. And it is true that more people have come into the United States for asylum under the Biden administration, but that's largely due to the bottleneck that was created during the Trump administration. So when you hear this rhetoric coming from both sides, just remember that, you know, the current situation, what people are calling the migrant crisis, really did begin and happen because of the Trump administration's policies. Now, the reason that something important to mention, I guess, and that is the commodification of migrants along the way. So every step of this process has been commodified, from you know, people selling packets promising people migrants that they can enter the United States if they pay this person X amount of money, to you know, Geo Group in the United States funding both sides of the political spectrum to receive you know, favor when it comes to private detention centers where they make money as well. So you know, in the field where we work here, you know, I can go, let me expand a little more, and then I'll come back to that. Just while we're talking about, you know, the current situation where we are right now, I went through the Trump and the Harris immigration policies and just kind of put together a quick, brief overview of what their immigration policies are. So under a Harris administration, they have promised that they would create a higher standard for asylum eligibility, essentially meaning that they want to increase how difficult it is to actually win asylum. So something that's different about asylum than other types of benefits, in immigration law they call it benefits, is asylum is what's known as a beneficiary, a discretionary benefit, meaning that even with all of the evidence in the world and the most cut and paste asylum case in the world, any judge has the ability to stamp it and say ineligible. It is up to the judge's discretion. And asylum seekers and migrants do not have the same access to counsel as American citizens do. So in immigration law, you do not have the right to a lawyer. And more often than not, if you do not have a lawyer, you do not win your asylum case. So that has been one major gap in all of this. And we saw that gap expanded under MPP. But I'll get back to that here in a second. Just to touch on the current immigration policies being put forward by each group. Harris, again, with the higher standard for asylum. She wants to change U.S. asylum law to protection determination, which allow asylum officers would have 90 days to conduct a fear screening, after which, if they fail, they would be deported. So essentially expediting the process for people to be put into deportation proceedings if they entered for asylum. She also would like to increase the detention capacity by providing ICE with nearly $8 billion of emergency funding and keep at least 50,000 detention beds available, which is an increase of 47% from the 34,000 beds allocated over the last 3 years. She wants to allow citizenship for Afghan allies, which is a positive, which there's not too many of those these days. But There's been a mention of increasing access to some legal immigration. So that would be an additional 250,000 in green card eligible employment-based family visas over the next 5 years. And then additionally, she'd like to add funding for asylum officers, border patrol, and lawyers, which would include about $20 billion in funding for the border to hire 4,300 new asylum officers. And a lot of that would go directly to border patrol and to further militarize the border. And that's pretty much all I was able to pick up from Harris's websites and campaign. Those are the cookie cutter bits, but Trump's is a little bit longer. So you may have already heard this, but he's promised to implement the United States' largest domestic deportation operation in American history. He wants to deport 11 million people. He's talked about using the National Guard. He's talked about using the military. He's talked about implementing workplace raids in order to do that. Another thing he wants to do is end birthright citizenship for children born in the United States from undocumented parents, which is completely unprecedented. He also wants to deport and revoke the visas of foreign students who participated in pro-Palestinian or anti-Israeli protests by proactively sending ICE to pro-Palestinian demonstrations across the country. He also wants to end Biden's parole programs. So this would include ending CBP One. This would end specific processes for Cubans, Haitian, Nicaraguans, and Venezuelans. This would also end certain pathways for Ukrainians as well as the Afghan arrival, the citizenship programs that are underway for Afghan allies that are coming to the U.S. and also some other parole programs, but essentially limiting the border to closing it entirely. Now, he wants to expand ideological screenings for visa processes. So this is an interesting one because the language that he uses is so vague. So they want to block entry of migrants or immigrants. The Trump administration considers to have undesirable attitudes, specifically sympathy for jihadists, Hamas, or Hamas ideology will be automatically disqualifying, which is quite vague and could be used in a whole sort of ways. So it's pretty dangerous Pandora's box to open. And that would also include vetting people with green cards and foreign students for the exact same, sympathetic ideology for Palestinian human rights. He also said he would continue building the wall. That's no surprise to anybody. And he also wants to reinstitute the Muslim ban, which would prohibit foreign nationals from Gaza, Palestine, Chad, Libya, North Korea, Somalia, Syria, Venezuela, and Yemen from traveling to the United States indefinitely. He also wants to end all temporary protective statuses for El Salvador, Haiti, Nicaragua, Sudan, Honduras, Nepal, Burma, Ethiopia, Yemen, Somalia, Ukraine, South Sudan, Afghanistan, Venezuela, Cameroon, and Syria, which would allow for their deportation back to those countries which are considered unsafe for them. And then a refugee ban to suspend the travel of all refugees to the United States. He's also promised that he would reinstitute Title 42. He also wants to reinstitute Migrant Protection Protocols, or what we talked about a minute ago, the Remain in Mexico policy, and implement what they call safe third country policies, which is would allow the United States to deport asylum seekers from El Salvador, Guatemala, and Honduras directly to Mexico or to those countries. And would also like to terminate all work permits for asylum seekers and migrants and also make them ineligible for public housing. So that's the overview of his immigration policies versus Harris's. Now, neither of them are really going to help fix this situation, but I think it's safe to say you can extrapolate which one is worse on your own. But I think it's pretty plain to see. So there's a lot of public health challenges that we see from migrants that are coming here. So they face a range of health crises from the journey. So we see a lot of dehydration, respiratory illnesses, broken bones, STDs resulting from gender-based violence, going untreated, chronic conditions going untreated, cancer going untreated, tropical illnesses going untreated. And all of these untreated illnesses, people don't have time or resources while they're traveling. And sometimes it can take months to years to complete that travel. And by the time people make it here, we've seen multiple cases where cancer specifically has matured to a point where there's just no way of saving them. Two people we know have died. One died 3 weeks ago at our clinic, actually, and because that emergency parole was unavailable, we were unable to get him to the United States to die with dignity with his family, unfortunately. But almost all of our patients present with PTSD. This is something that we're really working on implementing or addressing, in next year's strategy. But it is, nobody makes it all the way up here unscathed. It's a horrendous journey. And for a lot of migrants, their journey starts in Central America. So, for Haitians specifically, and the only two places that people from Haiti can go visa-free in Latin America is to Chile and to Brazil. And so what we see is a lot of Haitians that will have to start their journey in Chile or start their journey in Brazil, or have ended up in a situation in those countries where they themselves are unsafe and have to migrate to another country to seek safety, hence why they're coming here, which puts everybody going through the Darien Gap. And it's not just Haitians that have to go to the Darien Gap. It is so many different demographics. So we've, in our own clinics in Colombia, we've met 17 different people from 17 different countries that are traveling towards the Darien Gap. Now, there's different ways people can cross the gap depending on how much money you have. Typically, what you would do is somebody would pay a coyote. There's also people that are operating under the guise of tourists, a tourist group where you pay somebody to take you in a boat to as far north as you can get in the Darien Gap to be able to cross into Panama easier. And the U.S. has pressured Costa Rica, Panama, and a handful of other countries to, increase the restriction on immigration north through their countries. And we'll talk about that more in a little bit when we get to Mexico. But staying on the topic of the gap, everybody that I've met that has gone through the gap, I mean, it's hard to put into words how bad it truly is. There was one patient I talked to in Reynosa. Me and a friend of mine were interviewing her, and she said her trip wasn't that bad because nobody in her group died and she wasn't sexually assaulted. And that was the litmus test for, I guess, setting what good and bad was for going through the gap. Now, the journey through the gap can take 3 to 9 days, sometimes even more, especially if you're injured. And so one thing that we've heard consistently across the board from pretty much everybody that we've done an in-depth interview with, they've reported that, you can only carry so much water on you. And so you try to use your water sparingly, but once you're out of water, then you drink whatever water is available. And then you have to try to get out of the gap before you get sick, because you're drinking water that is contaminated with, it's contaminated water in a tropical zone, right? And maybe just for context, the Darien Gap is right in between the border of Colombia and Panama. And just so you understand a little bit of how treacherous the terrain is, the Pan American Highway extends all the way up to, I believe, Alaska, all the way down to the tip of South America. And the only place that they were unable to build it was in this spot in the Darien Gap because it was too difficult to build there, which just goes to show how treacherous the environment is. So some of our patients crossing through the gap pick up tropical diseases. So we've met people with leishmaniasis, filariasis, dengue, malaria, and often people that are crossing the gap, their one track mindset is to get safe, get north, get somewhere stable. So they're unable to treat these illnesses at a point where it wouldn't cause any lasting harm. So when they arrive in our clinics up north, oftentimes, leishmaniasis has, for example, spread from one spot on somebody's ankle to encompass their entire leg. Or in the case of filariasis, we had one gentleman in where it's a parasite. I'm not a medical person, so forgive me if I get some of the medical terminology incorrect, but it had advanced all the way up to his neck and was going towards his eyes, and had it led to that, he would have gone blind. Luckily, we were able to get him across. But dengue and malaria also pretty common. Now, sexual assault and physical violence are extremely common in the gap. Sexual gender-based violence is often used as a tool by criminal actors to extort and rob people crossing through the gap and throughout the journey. But people are also physically injured along the way. And drowning is reportedly one of the most common ways that people die while crossing the gap. And a lot of the time, if you're injured, your group can't continue without you. So, or sorry, continues without you, and you find yourself alone. A friend of mine, Ray, he almost died in the gap this way. But his buddy Tito stayed back and helped him get out. But that is one happy story out of a lot that aren't. So, yeah. And we had a patient recently who lost her kids in the gap. They drowned. She lost she lost her grip of her kids, and she arrived here alone with no family left. So it is, the gap is absolutely tragic. But again, it too has been commodified. So there are ways to cross the gap faster. So what we've noticed is a lot of Chinese nationals that are trying to either get to Mexico or get to the United States that may have more income. Typically, people coming from countries that are farther away are able to make it here do have more access to income, and so their journeys can look a little bit easier compared to some of the ones we're discussing. So they're able to go pretty much not entirely around the gap, but almost around the whole gap, right towards uh, the northern end of it where the Pan American Highway is. But in order to do that, you have to pay criminal organizations to take you there, to ferry you to that part of the gap. There's been some reporting on organ harvesting going on in Colombia and in the gap. There's a recent piece that I believe 60 Minutes did it. There's not that much information on that, but there is some investigations into that happening where migrants are being targeted for organ harvesting. Now, anyway, sorry, I'll continue. Is my internet connection stable, by the way? It just said it wasn't on my end.
It's great.
Okay, cool. So, another thing that gets constantly reported is, I guess I'll give you a specific example. We had a patient in Reynosa I was talking with about his journey through the gap, and he said there's a good rule of thumb, which is if you see a tent that's closed, don't open it, that there's a dead person inside. And then he talked about seeing dead bodies along the way. I don't have the statistics on me, but Massachusetts General Hospital did a study out there, and I forgot what the exact percentage was, but it was a high percentage of people that crossed through the gap physically see human remains of people who didn't make it, which is unfortunate. But yeah, I mean the gap, I don't work in the gap, I don't have a lot of experience there, but in order to get access to it, in order to cross through it, you have to pay criminal organizations to get there. And the reason that is such a problem, it is that the only way to regulate black market industries is through violence. There is no other mechanism. And so by regulating, the movement of people with violence, you end up committing violence on the people that are migrating. And the only way to address it if you're a rival cartel or a rival criminal organization is through violence. And so, yeah, we've seen that be a massive issue at all steps of the way. Now, I'm going to focus a little bit on health because that's where I've been working in for a long time now. But migrants, asylum seekers, refugees, they have additional access to barriers, inequities and access to healthcare. So obviously the language barrier is a huge one, but the racial discrimination is another. So we've had patients, patient descent, explain that they've gone to clinics and hospitals in Central America and been told that they don't have doctors that can treat Haitians, and told and explained that we don't treat Haitians, and there seems to be this misunderstanding in some medical circles that in Central America at least, that migrant bodies like anatomy is physically different than others, and therefore they're unable to be treated by their doctors, which is obviously not true, but it's an unfortunate reality of the situation. Additionally, one metric that we do know about is the C-section rate for Haitian women, at least in northern Mexico, specifically in Tijuana, where we have data, is like 90% higher than the general population, which is unfortunate. But I've spoken to some doctors there, and they were told by the hospital that one of the reasons for this is that they're louder, which is another just another trope, another racist trope that is that causes harm, right? Mothers that may not want to have C-sections are forced to have C-sections because it's easier on the providers. Additionally, during COVID, people weren't allowed to have another person in the room, which makes that even a more traumatic experience. And even still, sometimes they don't let other people in. Now, I already mentioned a little bit about how CBP One, negatively affects health. We did an actual study on it, but just for just some examples, so let's say, for example, you are in active hiding from your partner and you go to a domestic violence shelter. Now there's multiple of these shelters along the northern border, and one of them that I know about, at least before CBP One, you weren't able to have your phone. Just, it was a security issue. If you were to reach out to that person and they found out where you were, that would disclose your location. And so if you don't have access to your phone, you don't have access to CBP One, you don't have access to asylum, which in a lot of cases is people's only opportunity to find safety. And that puts those individuals in danger. And we currently have the exact same situation going on in other cities in northern Mexico. So less so in Matamoros, but more so in Reynosa. It can be extraordinarily dangerous for people to leave shelters, to go buy data, to go try to find a better signal, to even make it to your CBP One appointment. So now I guess I'll go a little bit into detail about how the commodification has changed along the way. So, back with metering, when metering happened, the United States government essentially, we'll go back to 2018 here, they put all of the organizing efforts and the list of creating this line of who's next for asylum into the hands of nobody. It was just said, next in line, and that person is then in charge. And what we saw in Matamoros, at least, was that instantly was commodified by a local criminal organization. So there are two bridges in Matamoros. One is privately owned and one is publicly owned. And the publicly owned bridge was not allowing migrants to wait physically on the bridge, in the middle of the bridge. Now, that's important because in the middle of the bridge, Border Patrol has a checkpoint, which is relatively new and was built to keep people from stepping foot in the U.S. where they couldn't be turned back for asylum. But that's also where they would decide who was next in line. And because of that, everybody waiting at the public bridge, because they weren't able to wait in the middle of the bridge, they were never identified as next. So what happened was that the old bridge is what we call it, which is privately owned. That person, whoever owned it, was allowing asylum seekers to wait on the bridge. And an individual came in, created a list, and started charging people to get on that list. And if you didn't pay to be on the list, you were kicked out and told to go to the new bridge. And if you didn't follow those rules, at least in one case that I know of, someone was disappeared, her and her daughter, after refusing to go to the new bridge, and then deciding to go and did not make it. And the bridge is less than a mile from one another. And I never was able to find out how much people were getting charged, but there seemed to be a tier system. I remember one day we went over there. This was back when we were doing food distributions. This was before the medical days. And there was a family that had just showed up in a taxi with, nice luggage and everything, handed an envelope over to this person. And by the time we were done serving dinner, they just so happened to be the next people in line. And what that did was the people that had more money waited on the new bridge, and the folks that are typically that did not have the funds were at the other bridge. So those folks sometimes had to wait for months. Nowadays, that doesn't sound like such a long time, but back then, there was no migrant serving infrastructure available for asylum seekers at the bridge, except for a once a day food distribution. So there was no medical, there was no psychological, there was no safe housing, there were no safe shelters, right? There was no infrastructure for these things. And so people that were sick and people that were ill and people that were actively fleeing persecution in Matamoros would get stuck at that bridge for extended periods of time, and people went missing, people disappeared, people were forced to wait until they couldn't. Additionally, if these folks decided that they could not wait any longer, and tried to swim the river. The river is also commodified. So different criminal organizations own different parts of the river. So if you want to swim across the Texas-Mexico border to the U.S., you have to pay somebody. And if you don't pay somebody, well, then if you get caught and get deported, there's consequences. And that can be a beating, that could be an extortion, that could be having to pay a fee. We've seen all three of those things, specifically in Reynosa. But there's an entire operation that has been set up, that was set up around that, where there's people that watch the bridge. And if you are deported back and you had obviously tried to swim the river, and you can typically tell because you'll have muddy shoes, you'll still have, the same mud on your clothes, you won't have shoelaces, it's easy to identify. And these people will notify whoever's plaza this is that this person didn't pay, or this is someone who swam without paying. And we've known of these people being kidnapped and extorted and being forced to pay exorbitant fees. And the reason that migrants are targeted so much is for a few reasons. One reason is that they are undocumented a lot of the time here in Mexico. They their lives, unfortunately, are viewed as less than by so many different parts of society. And the big one is that there is this preconceived notion to connection to U.S. money. I mean, if you're going to the U.S., a lot of the time you have family there. And if you have access to U.S. money and you're a person that the police aren't, that's not going to go to the police, that isn't going to report, that makes you an easy target, especially for criminal organizations in a place that, those organizations have a lot of pull, have a lot of say. And so, that's why it's such a big market. And as these policies have gone on, it has created a larger and larger and larger driver, I guess, for these By under metering and under MPP, putting all of these people in a situation where they cannot leave the bridge and they cannot leave the city, essentially pools everybody into one location, and it makes it very easy for criminal organizations to target these individuals because they're all in one location and they're unable to leave and they don't have the resources to find housing elsewhere. And so during metering, we saw a handful of cases, but it got especially bad under MPP. And so under MPP, under Migrant Protection Protocols, like we said, people had to wait in northern Mexico, or technically Mexico, but you had to wait in northern Mexico because your court date was on the other side of the bridge, and then you would get sent back. Um, during that time, I think the approval rate for asylum was like less than 1% because access to counsel was almost impossible, right? Most immigration attorneys work in the interior. They work in major cities inside the United States. They don't necessarily work at the border or are willing to cross the border. And so most of these individuals went to court with zero representation, not understanding how the system worked. And also too, not just having a lawyer there, but not having access to even free social services or legal seminars, or things that people can access in other cities. Those resources just weren't available. So many different groups came together to try to create them, but unfortunately, it still was not enough, and the denial rate was absolutely through the roof. And during MPP, people became desperate. There was a lot of people that did not feel like they had any other choice but to cross irregularly and go through the river. And in one case, there was one person I knew of who tried to swim, did not pay, and he was made an example of, and he was killed. These things were so common. Forgive me if I speak about this without that much emotion. It's just this is something that we talk about a lot. It's not that I don't care. I care a lot. I just you get used to talking about it. But working in at the time I worked at a different NGO, and we were helping run a kind of a safe house network where we would, if someone would come to us and let us know, I didn't pay, or I need help, or I just got out of the situation, I need to get out of the city, we would help them get to a different shelter or get on a safe vehicle to go to a different port city, like Reynosa, or to go wait in Monterrey, until they caught up with us and politely asked us to stop, said we couldn't drive migrants around anymore unless they were staff and they wore a uniform, and these organizations gave us direct orders not to drive migrants around, and they specifically said, don't mess with our merchandise. That was their words. That was the way that they referred to migrants as. So yeah, and unfortunately, that's common across the board, not just in northern Mexico. So after MPP, or sorry, even during MPP, after the Biden administration got into office, there was a lot of protest in the main camp in Matamoros, and those folks were allowed to come in. But there was a lot of people in the city that were waiting to access the camp that had been built in Matamoros, because it had a lot of services, it had a fence, it was in a lot of ways safer than a lot of other places. By no means was it safe, but it was safer than a lot of other people's situations. And unfortunately, the Biden administration, let everybody in and then demolished the camp. And so all of the infrastructure, all of the social capital, all of the security protocols, all of the everything, all the aid clusters that we had built up, the water sanitation and hygiene infrastructure. I mean, we had built an off-grid water system that filtered the water out of the river. All of that was destroyed. And 2 weeks later, we saw people start arriving in Reynosa instead. And that was the beginning of the camp in Reynosa. That's when we shifted our operation over there. And the camp in Reynosa did not have any walls. It was located right by the bridge in a little plaza, and people were really picked off out of that camp regularly and easily and extorted. Uh, and kidnapping and extortion is a huge problem in Reynosa. It has been for a while, and it's gotten a lot worse more recently. But back then, we had cases in kidnapping. There's different types of kidnapping. So one is phone kidnapping, for example, where someone will get a hold of somebody's phone, pretend that they have that person in their custody, and that if you don't send them money, that they're going to hurt them, harm them, or kill them. When in reality, they just had stolen that person's phone. There was one case where a patient, was kidnapped and on their way to come to a follow-up appointment, and said that the people that kidnapped him were nice. They stayed in a one-room apartment. They watched TV. They had 3 meals a day. That's not the normal, but that was one instance. We've had other instances where people are taken to more of like a warehouse situation, where lots and lots of people are, kind of corralled in, and people wait for their families to pay these ransoms. Um, and we've also seen cases where violence and sexual assault are used as ways to coerce these people's families in the U.S. or elsewhere to pay ransom. In one case, water torture was used that I know of, where a mother and a son were one's tied to a chair on this side, the other on this side. Anytime the mom cried, she was dunked. Every time the kid cried, vice versa, he was dunked. This was filmed and sent to a family to try to get their extortion money paid, and it worked. There's other cases where children, boys and girls, and adults have been sexually assaulted, which has been filmed and sent to families as a way to coerce people to send a ransom. And these ransoms can be anywhere between, $1,000, $2,500, all the way up to $10,000, the highest that I've ever heard. But yeah, there's many different ways of people being extorted and kidnapped, but it changes as immigration policies change. And so, as Title 42 got phased out, and as MPP got phased out and CBP One got implemented, what we saw was people coming up for their CBP One appointment, and then they would be kidnapped right before their appointment. And so there was, the time crunch was on to get the extortion paid, as an additional incentive for these criminal organizations to receive the payment for the family so they can make their appointment. And a lot of people miss their appointments that way. Most of our long-term patients that are here now, that is one of the main reasons why they're here. I don't have a direct percentage, but it's a substantial number of our patients. But my main point I'd like to get across is that at every step of the way, criminal organizations find a way to monetize people seeking asylum. And again, that goes all the way up to the US. So, here another way that is less violent and less criminal organized and more scammer is, notorio públicos is what they call it in the States, where people will pretend that they are an immigration attorney or that they're a pastor, and that they can get you in a lot faster, and you have to pay X amount of money or go to X shelter. And then you find out later after paying that it wasn't true. You were just scammed out of all your money. In some cases, these people will even fill out immigration paperwork, do it incorrectly, submit evidence that hurts cases, and people will lose their case. That's something that's common on both the U.S. and the Mexico side of the border. Yeah, and again, that's something that we continue to see today. Let's see where I should take this to next. Yeah, let's see. Sorry, bear with me. I mixed up my notes. Yeah, so we kind of touched on the monetization and kind of the situation here in Reynosa, Matamoros, but something more recent, and this is more, I guess, a political point. Whereas, you know, one thing we've noticed with Republican administrations is when they've come into office, they act quickly to implement these types of restrictive immigration policies through executive orders, and they push and they push and they push. Whereas Democratic, under the Biden administration, what we saw was a lot of inaction up until the very end. And the reason that the numbers recently have decreased so much at the northern border is pressure on the Mexican government to increase internal deportations of undocumented migrants back to southern Mexico to await for a CBP One appointment. And so, you know, we've seen that increase and increase and increase. But so I guess I'll back up a little bit for context. So once you arrive at the Guatemalan Mexico border and you cross, you go to, most people go to Tapachula. That's where most people enter and most people cross. From Tapachula, the only way to travel north is to get a CBP One appointment or to apply for asylum in Mexico, which gives you travel permits to move north. Now, applying for asylum in Mexico hurts your opportunities to receiving asylum in the United States, which may be a feature, not a bug, of this joint internal deportation mechanism. But you know, as more and more people have arrived in Tapachula, the Mexican government has started deporting people to other cities instead. So one thing we've noticed is the numbers in Villahermosa, Tabasco, which is another state on the border with Guatemala, another Mexican state on the border with Guatemala, went from having very few migrants. There were some migrants from Guatemala, El Salvador, and Honduras that would occasionally cross through there and end up in Villahermosa while they wait for their paperwork, but it was not very many. And over the last 6 months, 6 to 8 months, we've seen that number increase dramatically. And there's very little aid, migrant facing aid services available there. And that's led to a lot of, you know, backlash from the local community. It strains local resources, but it's also being done as a way to keep the numbers low at the northern border. And so Tapachula, Villahermosa, and Tuxtla kind of operate as an extension of the U.S. border, by, you know, keeping migrants farther south so they can't move farther north. Now, another reason for the internal deportations back down south and the increasing of that is likely due to, after the implementation of CBP One, it first started off where you had to be within, you know, X amount of miles away from the border to apply. So you had to be in a border city to apply. And that led to an increased number of people coming, getting kidnapped and extorted. And in response to that, the Mexican government agreed to allow the CBP One to be used anywhere north of Mexico City. And so what ended up happening was a lot of people were, you know, getting out of Villahermosa, Tapachula, Tuxtla, and going straight to Mexico City, which led to a large increase of asylum seekers there. Some camps popped up, some shelters are there. I believe there's only one camp left because in response to that, they again increased internal deportations and also extended the accessibility to see the CBP One app. Extended the CBP One app for people to be able to apply in Tabasco and Chiapas. And so there are people that have been deported back to Villahermosa more than once, more than twice, you know, 3 times in some cases, all awaiting for their CBP One appointment. All of this is to say that there is no major solution here. And just because the numbers that we see at the northern border, and the numbers crossing may be lower right now, it's artificially low. There are still people coming. It's just that the barriers that are being put in place are increasingly brutal and increasingly effective by means of making it so treacherous and deadly that people either don't try or get stuck in this cycle until they're able to get an appointment. I know my time is getting up, so if anybody has any questions, I think now might be a good time to go ahead and ask. Feel free to ask anything.
Thank you. Wow. Um, thank you. Thank you, Brendon, for putting this in such clear terms and in making a situation that is incredibly complex, giving us such a clear explanation of what's happening. So I appreciate that. I have several questions already lined up, but please, if you want to ask some questions, please make sure to put them in the chat or mainly in the Q&A button. That would be the best. So I have two already here in the queue. One of them
Right.
from an
Yeah,
anonymous
so I see a question.
Yeah, that's the one from an anonymous attendee. When asylum seekers use CBP One app in the southern Mexican states, is the process still similar to what it was like at the northern border? Are there any differences?
I mean, the process is similar. Yes, you still have to wait in between 6 and 8 months to receive an appointment. So about half of, I believe that about half of the appointments are done on like a lottery system, so it's random, while the other half is whoever signed up first. So like, first come, first serve style of waiting. But yeah, the average wait time is in between 6 to 8 months. And that process restarts if you miss your appointment or if someone from your group is absent when you arrive for your appointment, or if there's an additional person in your group, or you reset your application.
Wow. Okay, so Iole Fontana, I
another
think,
question.
yeah, she did. Iole Fontana put this on the chat. It's, can you elaborate a bit more on the relation between CBP One app and the June 2024 executive order? Is CBP One affected anyhow by the June, anyway, I'm guessing, or anyhow, by the June executive order in the sense of reducing the number of available appointments via app until the border crossings do not get back to a certain threshold? Or the two things are completely unrelated? And by the way, she says, thank you so much for the wonderful presentation.
Thank you. Sorry, I'm not sure if I understand the question exactly.
So it's about
CB1 effect.
are the CBP One actually affected? Is that is there any relationship between the CBP One app and the June 2024 executive order, in the sense of reducing the number of available appointments, or are these two unrelated things?
My understanding is that the number of appointments is remaining the same. I could be wrong. There are other people that are better at CBP One than I am, but I think the numbers of appointments are staying the same. I think that what the restriction is the inability to apply directly at a port of entry without an appointment, or to apply in between ports of entry, crossing irregularly or entering without inspection. I hope that answers your question.
Thank you. I have one more question. Actually, someone wants to know, how did you end up in this line of work? How did you end up doing this?
Well, I'm from the Texas Hill Country and pretty far right upbringing, and yeah, I don't know. I turned into an adult and realized that the world is messed up, and I joined the Poor People's Campaign. Went to a protest in DC on accident I went to the Capitol there instead of the Capitol in Austin. Got invited to a protest in Brownsville and met a lady who was trying to start like an Occupy movement at the detention center where the separated kids are at. And so I joined her and never left. I mean, I met Team Brownsville and just kind of got right place, right time, got plugged into the right people. And yeah, I mean, the one thing I do want to add that never gets brought up that's super important is the local organizations here and the people that are operating here. It's amazing what they're able to do. And the recent shift to localizing everything on the Mexico side is even, I mean, more impressive. I mean, Casa Migrantes, Ayúdanos a Triunfar. There's so many local faith groups, so many local grassroots organizations that get zero credit that do so much work. It's insane. I mean, the quality of life and the standard of living in shelters here now is so much better than before. I mean, they're up to sphere standards on everything except tent spacing. It's impressive to see what happens when local organizations in Mexico are running things by themselves. I know that was off topic, sorry, but yeah.
No, that's great. I actually had something related to that, but I'll wait until the end because there's so many other questions people are asking. Doctora Berta Bermudez Tapia asks, "Hi Tucker, thank you for your presentation. Can you please talk about the challenges that asylum seekers have experienced using the CBP One app, particularly Black asylum seekers?"
Yes. So especially at the very beginning, when they implemented the app, the facial recognition technology, whatever it was based off of, was obviously not meant for Black faces or Black people. And so they had a hard time getting the biometrics to actually scan their face. Additionally, I mean, and that would make it to where you couldn't get an appointment or apply. Also too, so where migrants are located, right? So a lot of Haitian migrants were located in more remote shelters or more remote locations and didn't have access to shelters that may have had faster Wi-Fi. You know, so one example, like when I worked in Reynosa, on any given day, if you were every day we would drive to clinic in the morning, you would see people gathered at every corner where there's a Wi-Fi spot or anywhere right outside the yoke. So everybody's buying data, trying to get the best signal, whilst other shelters that didn't have any Haitians in them at the time had access to Wi-Fi and other services. So what ends up happening is specifically for Black migrants, I mean, those that aren't inside of shelters, the software itself, you know, has racism built in. But also to vulnerable populations not having access to it. I mean, I mentioned the domestic abuse shelter, but there was one case in Reynosa where I remember this one really well. Actually, it was right after CBP One got implemented. This woman had just she was dumped off in the plaza in front of our clinic. She had been held for 2 weeks by her kidnappers. And she was released without a phone, without any money, told to do something. She didn't tell me what it was, but she said she wasn't going to do it and asked to borrow a phone to call somebody. And I said, sure, you know, you can use my phone. She had no money. She had no money for data. She was afraid to go to any of the shelters since that's where she had been picked up at. And because of that, she had no access to CBP One. We managed to get her into a safe house, but then she left and we never saw her again when she went to go try to get a phone. But yeah, if you don't have a phone or you don't have money for data, then you don't have access to asylum. And so the people that have absolutely nothing or that are in active hiding or are actively fleeing or are released from their kidnappers with nothing are the ones that are affected the most. So the more resources and the more money and the more access that you have, the easier it is still to access asylum, which is kind of defeats the whole purpose. Asylum is meant to be a benefit that is available for the most vulnerable people fleeing violence, while these restrictions specifically limit those individuals from accessing the benefit it was created for, if that makes sense.
No, that makes perfect sense, and that was one of the things that was incredibly clear that I took off of your whole talk is like we're making a vulnerable in fact the most vulnerable populations even more vulnerable, and we're making it even harder for those that are most vulnerable to actually achieve the goal of asylum, which is the whole reason for asylum, which is it's crazy. But I'll have two more questions, and then I have one too. Once folks pass the CBP One interviews in the south of Mexico, are they bused to border cities in the U.S.? Are you seeing any of those people in Matamoros or Brownsville?
So there's been more buses are coming right now from sorry, the safety corridor that was implemented by the Mexican government, I think actually is getting stopped. I'm not sure if it's going to continue, but it depends. So once you have your CBP One appointment or your FMM or your permission to travel north, if you have the money, you can buy a plane ticket. So one thing that we see, excuse me, a lot from like the Cuban population that has strong ties in the States, they can fly directly from Tapachula to wherever their appointment is. A lot of the time, if you have the resources, people will fly to cities like Monterey to wait until a couple of days before their appointment before traveling to more dangerous cities like Reynosa and Matamoros. But yeah, I mean, you can hypothetically get a bus, but a lot of people are concerned, once you get an appointment, sometimes, especially if you're leaving from a place like Villahermosa, and the bus might not take you all the way to Matamoros or Reynosa. There's also been issues where, buses have been commandeered and all migrants have been taken off and kidnapped in mass, traveling in and out of Reynosa. So that's, yeah, I mean, traveling north, depending on how much money you have and depending on which way you take, there's a lot of different outcomes from that. I hope that answered the question.
Yeah. So here's my question, since we're running out of time. Um, so in your estimation, what is of
Oh,
it's an incredible picture that you painted for us, right, of the situation in the border in terms of protections, the lack of protections for asylum seekers and certain
sorry,
protect.
you cut out. Could you repeat that?
Yeah,
I
yeah.
just turned off my camera.
You painted a very clear, and I'll do the same with mine in case that helps. You've painted a very clear picture for us of the lack of protections that are happening at the border with these vulnerable populations, and the way that these gaps have been filled by criminal organizations and violence, right? So, in your estimation, what what should be the Mexican and American government's responsibilities towards these vulnerable populations, given the situation there? What should they be doing, right? Both countries in terms of protecting the human rights of these vulnerable groups.
Well, that's a really good question. I mean, so if you look at the reason why so many people are coming here in the first place, it stems a lot of the time from U.S. foreign policy. So, for example, Haiti is a perfect example. Y'all may remember the caravans traveling north back in 2018, 2019. Coming from Honduras, they were fleeing Juan Orlando Hernandez and Pepe Lobo, the government that we helped put into place after overthrowing Zelaya, right? I mean, we have a responsibility to take care of the people that we're destabilizing and bringing up north. Now, that's going to look more than just fixing asylum. This is a global issue, right? We need to, one, I recognize that there are climate refugees and create a status for that inside of U.S. immigration law. We need to massively expand the types of visas and access and pathways for people to enter the United States. We need to implement ways for people that are already here to be able to have work visas, to find a way to get status. I mean, and all of this takes funding. All of this takes we need to take a different approach. This isn't just going to be an immigration approach. It's going to, if you really want to fix it and you really want to get to the core of it, it would have to dramatically change the way that the United States collaborates with the rest of the world, because unfortunately that is one of the main drivers of what we see here. After we pull out of Afghanistan, we started getting people from Afghanistan. I mean, we see people from, as soon as the war in Ukraine popped off, we started getting people from Ukraine, from Russia, from Belarus. We have people from Uzbekistan and Kazakhstan from crises over there, right? I mean, a lot of this stems from, the way we collaborate with the rest of the world. So, I don't know exactly how we could fix it. There might be some things that we can do in the medium term to fix a lot of this, which would be go back to Title VIII, invest heavily in asylum officers, listen to asylum advocates and listen to immigration advocates when it comes to creating informed policy, right? Expanding safety corridors in a way that aren't meant to specifically increase internal deportations and access to safer cities, right? The United States could change the way that the way that they are, where the CBP One locations are at. I would say the Mexican government is doing a lot more than the U.S. government on this. By collaborating with organizations. The public healthcare system here has been really open to working with us and with migrants. But to fix this, it's going to take more than just fixing asylum law. It's going to take a dramatic change in everything. I mean, really, this is, unless we address the fundamental causes of this will be the future of migration globally, and it does not seem to be shifting back towards a better way. I mean, it only seems to be getting more restrictive and violent, and that's a global trend.
Well, thank you so much for this wonderful presentation, Brendon. It's amazing, some of the things that you have told us and some of the things that you have explained so clearly for us about the situation in the border with asylum seekers, and what a change in policy to make it more difficult to cross, how it can make vulnerable populations even more vulnerable and cause more problems than it solves. So we really, really appreciate your expertise. It's pretty amazing. And I personally want to thank you for everything you're doing for these populations right there in the trenches. So thank you so much. We're receiving a lot of applause in the chat. So thank you. We really do appreciate you coming here and sharing with us your expertise on these matters.
Well, thank you so much for inviting me. I will happily share some resources if anybody here is interested in learning more. I have some things that I'll share with Dr. B to get shared out. Also, to please draft your comment to fight back against, cementing this transit ban. That's due on November 4th, and I will send Dr. B a little write-up on how to do that. So everybody here, if you want to make a little bit of change, that is something you can do today. And anyway, thank you very, very much. I appreciate it.
Perfect. We really do appreciate it, and we will send it to everyone that was in this talk and to our students, etc. Thank you, everyone that remained with us for far past our time. We really appreciate it. Like always, we thank you for attending the speaker series for the Center for Latin American and Border Studies. My name is David Ortiz again, and we'll see you in the next one. Thank you so much. Bye-bye.